Hi Maria, thanks very much for being willing to talk to us today about your experience of research. Could you tell us a little bit about your background and what's got you into research?
Sure. So I'm a clinical psychologist by training. I trained 11 years ago now, and when I qualified, I went straight into a full-time job in child and adolescent mental health services. I worked in child and adolescent services for several years, not doing really any research at all beyond the odd audit within that context. But increasingly, I was interested in teaching. And I then got a job as a lecturer on the Doctorate in Clinical Psychology training program at the University of Bath. As part of that job, I was required to do some research. And so really, I guess I came to it somewhat reluctantly out of necessity, but found that I was then incredibly interested in it and actually have real passion for it now that I'm doing it more.
And can you tell us about the NIHR funding you've had?
Sure, I've been incredibly lucky to get a really generous fellowship from the NIHR. So it's a doctoral research fellowship. That means I'm doing a PhD as part of the research. I'm doing a program of research that's valuable to the NHS, and that's a definition required for getting NIHR funding. What I'm looking at specifically is teenagers with chronic fatigue syndrome who are also depressed. And I'm doing a series of studies to understand more about that group and how we can begin to better help them in NHS clinics. The funding provides both some support in terms of resources around the actual research, so things like funding for patients to travel to our clinic for research assessments, but it also provides extensive funding for my time, so it buys out 3 days a week of my time for 5 years. I've opted to do it that way. You can do it more full-time. And it provides me a package of training in terms of developing me as a researcher. The idea of the fund as a fellowship is that it develops my capacity to be a research leader in the NHS in the future. So I'm attending all sorts of courses. For example, I attended a course on designing randomized control trials, a week-long course. And that's really helping me to develop my ability to be a better researcher for the future.
So any tips for how to successfully apply for funding if people want to follow the path you've taken?
Well, for me, I started small. So when I came to the job at the university, I first did a couple of projects that were unfunded projects, and I did those in collaboration with other people. I linked up with a couple of other academics who were already doing projects in the broad subject area I was interested in. I then got a very small pot of funding to buy out just a little bit of my time to do a systematic review in the area of chronic fatigue syndrome. That funding came from a charity. So there's lots of different pots of funding like that that you can apply for. Following that, I got a slightly bigger pot of funding that brought out a little bit more of my time to develop a grant application. And then I came on to developing the application for the NIHR. In terms of top tips, beyond starting small, I would say don't underestimate what a big piece of work it is. It took me the best part of a year to put together my application to the NIHR. And there are lots of things that I wouldn't have known about without the support of colleagues at the university. The research design service and the research innovation services at the university were really helpful in doing things like helping me with costings and understanding what kind of language to use in answer to certain questions about, say, the institution or the support I have around research. So I'd say link up with those kind of services. Universities are always keen to hear about and to understand more about projects in the NHS or in other clinical settings. So no matter whether you are a member of university staff or not, there's always opportunity to link up with people and to use those kind of resources. the NIHR also run days and webinars and so on and so forth that really help you to understand what the requirements are of the different programs. So I think that's really helpful too.
So it sounds like you found academics and the NIHR quite open to approaches to get you involved in research. Okay, great.
Yes, there's actually so many people out there who are keen to help.
Yeah. Any tips for making the most of funding once you get it?
I think the biggest thing is protecting your time, protecting the time for research. I think it's so valuable to get that time, but then it's about boundaries and time management. And I don't think that there's an easy answer to that, but really, I guess making sure that you're making the most of that opportunity that's presented to you once you've got the funding is really important.
Okay, great. And I guess not everyone's going to want to go as full-time into research as you have. Any tips for how to get research active alongside routine clinical work without funding?
Absolutely. And as I say, I started in a place where I had no idea I was going to become so keen on being research active. But I think the key thing is to make links, to collaborate with people who are more research active and to work alongside them. That can be a really great way in and of itself to just do a little bit of research without fully immersing yourself in it. I think also all the universities have students at different levels, psychology students, medical students, who are really keen to do placements and are required to do placements as part of their course, that you can then call on to be research assistants. I think the hardest thing about doing research when you're unfunded is finding the time to do it in amongst all the other clinical demands. So actually drawing on those kind of resources like students to do placements. For example, an undergraduate psychology student on a sandwich year comes on a 9-month full-time placement. You can really get that person to do some great work and to help you further a trajectory of research without necessarily having funding. So linking both to academics who are already doing projects, but also to thinking about what resources you can draw on to help you to do projects in and amongst the other demands on you is really helpful, I think.
So I think it's pretty clear from what you said that your clinical background helps you be a better researcher. Have you noticed any transfer the other way, that being research active is improving you as a clinician?
Enormously so, and I think that was a benefit I never expected to have. But I think really the skills in understanding the evidence base that I've improved on as a result of really doing much more research myself have helped me enormously in thinking about what might work for whom and what the limitations might be of what we already understand in terms of what to do when. I think also just the space that it's given me to really understand in depth a subject area has been enormously helpful. As a clinician, you're inevitably always firefighting, whereas as a researcher, you're really specializing on a very narrow area. I like to have a bit of both in my working life. I don't think I would be any good at just one or the other. So I think they're, incredibly mutually reciprocal.
Thanks, Maria. That's really interesting. Thank you for your time. I'm just
Thanks,
stop recording.